How to put an end to the spread of COVID in aged care homes. Restricting the effective control and prevention of the infection can make it spread. There is a need to take proactive measures to protect the health of the people in aged care homes. 1. Perform hand hygiene. Performing hand hygiene is the most vital thing visitors must do. Washing of visible hands with soap and water should be done. Performing of hand hygiene for a minimum of 20 seconds with soap and water or alcohol-based hand sanitizer that contains 75% of isopropyl alcohol or 80% ethanol to cover the entire surfaces of your hands and continuously rubbing them until they dry. 2. Encourage visitors to perform respiratory/cough etiquette. Visitors should use tissue on their nose and mouth when coughing, wiping, sneezing, or blowing the nose. It is very important to dispose of the tissue into the trash can, and then perform hand hygiene using soap and water or an alcohol-based sanitizer. In the absence of tissue, do not cough or sneeze into the hand but the elbow. 3. If visitors are sick, place restrictions on those who are unwell from visiting residents in aged care facilities, such as those having a cold, fever, or have diarrhea. This will go a long way in spreading the virus to others. 4. Maintain good air circulation. Allow for more ventilation by opening doors and windows. Be sure that there is good airflow in aged care homes. This is essential and should be maintained at all times. 5. Surgical masks. Care workers protect their nose and mouth from being exposed to infectious agents using a surgical mask. However, remember to always avoid touching the front of the mask with hands once it is in place. Avoid using mask for a long period of time once moist or dirty. Dispose of mask after use and perform proper hand hygiene immediately. Wearing of the surgical mask should be mandated for symptomatic residents. 6. Handling of food. Hand hygiene should be done both before handling food and wearing gloves. Stay away from buffet style of serving food, or via communal dining. Rather, meals are to be prepared and served individually. Only the designated persons should plate the food, and only one person should handle serving implements. Wear gloves or use the waterproof dressing to cover sores, cuts, or injuries before handling food. Use different kitchen utensils and chopping boards for cooked or raw foods, or wash the singularly available board with soap and warm water. Avoid touching food after touching surfaces, body parts, earrings, mucus, blood, skin lesions, money, and sweat without observing proper hand hygiene. Cover your hair and tie back long ones. 7. Linen and laundry handling. If possible, put on gloves when working with linen and laundry. Proper hand hygiene should be done after working with linen and laundry. Bring laundry basket beside the bed and put linen straight into it. Clothes or bedding that have stool, blood, or body fluids on them should be removed and washed immediately. 8. Cleaning and disinfection. COVID cleaning and disinfection are required and recommended for every homes or public places like aged care, schools, offices to kill any possible virus that may be growing on every surface of the building or facility. Cleaning involves getting rid of dirt, germs, and impurities from surfaces. Cleaning alone cannot eliminate germs, but removing them reduces their number, as well as the risk of them spreading. If this content has been useful for you, do not forget to subscribe and follow us on Facebook, Instagram, and Twitter. We are posting tips and interesting content for you. Thanks for watching, see you next time.